Welcome to our channel, Hashmi Clinics.
All right, let's get right into it. Today, we're doing a deep dive on Actaea Spicata, also known as Baneberry. Now, this is a remedy that you absolutely need to know, especially for those tough rheumatic cases, the ones where the pain zeroes in on the small joints with this incredible, almost shocking intensity. So let's break down its very unique picture.
So here's how we're going to tackle this. We'll build our understanding from the ground up, starting with its core essence. Then, we'll paint a picture of the patient who needs it, get into the nitty-gritty of the physical symptoms and what triggers them. And then, to really sharpen our prescribing, we'll compare it with some of its closest relatives.
Okay, let's dive in. First things first, what is the fundamental character of Actaea Spicata? I mean, what is the absolute, undeniable core of this remedy picture?
At its very nucleus, Actaea Spicata is a rheumatism remedy. But, and this is key, it's incredibly specific. It doesn't just go for any joint, it targets the small ones. We're talking wrists, fingers, ankles, toes. And it does it with this uniquely violent kind of pain that patients will describe as tearing and tingling.
Now this right here, this is the grand keynote. Seriously, if you remember only one thing about this remedy, let it be this. Imagine a patient who feels perfectly fine. They go for a short walk and bam, they get such acute swelling in their joints that they're literally forced to stop and go home. This extreme, out-of-proportion reaction to the slightest fatigue is the absolute calling card of Actaea Spicata. So with that core idea in mind, let's build out the picture of the patient who needs this. Who is the person actually experiencing all these symptoms?
You really see two sides of the same coin here. Mentally, this patient is living in a state of fright. They're anxious, they startle easily, and there's often this deep fear that you can trace back to a specific event. And this mental tension is just mirrored physically. Constitutionally, we're often looking at a chilly, older man who has this really peculiar and profound exhaustion that just hits them out of nowhere after simple things, like eating a meal or having a conversation.
Okay, now let's get even more precise. We've established the small joints, but where exactly and how do these symptoms show up?
The identity of this remedy is just overwhelmingly tied to the joints, and its absolute center of gravity, the place it hits the hardest, is the right wrist. Sure, other small joints can get involved, but the right wrist is where the pathology really localizes with incredible intensity.
And this slide really shows you the violent nature of the inflammation we're talking about. These aren't just dull aches. The pains are tearing, they're drawing. The joint is visibly swollen, it's red, and it is exquisitely tender to touch. The pain can be so severe that it effectively paralyzes the limb, making any movement completely impossible.
This description from the Materia Medica is just perfect, isn't it? It sums up the entire acute state. It paints this clear, undeniable picture of intense, localized inflammation that you just can't miss when you see it in the clinic.
But the pathology isn't just confined to the joints. It often extends up into the head and face. And what's so fascinating is that the character of the pain, that signature pain, it remains remarkably consistent.
See? There's that word again, tearing. The same pain signature shows up in these neuralgic symptoms, which creates this beautiful, consistent theme. The facial neuralgia is intense. A lot of times it starts from a tooth and just shoots up to the temples, and it has the exact same extreme sensitivity to touch and movement as the joints do. And that blue vision? That's a classic, strange, rare, and peculiar symptom. It's a fantastic little confirmation when you can get it.
We also see some really important symptoms pop up in the digestive and respiratory systems, and these can be absolute gold for differentiating the remedy.
This link between gastric issues and rheumatic complaints is a crucial diagnostic clue. You get the same tearing, crampy pains in the stomach, often with sour vomiting and this feeling of respiratory distress. It really completes the picture of a system-wide disturbance that's rooted in what we call a rheumatic diathesis, basically a constitutional tendency toward this specific type of pathology.
So understanding what brings these symptoms on and where we can apply the remedy, well, that's vital for success in the clinic. What are the triggers that we should be looking for in our case taking?
The causative factors are really clear. The whole state can be kicked off by mental stress, physical fatigue, or simple mechanical strain. You should always be asking about a history of fright, or if the symptoms first appeared after a period of overexertion or even just simple fatigue.
And you know, while it's famous for rheumatism, its clinical usefulness actually extends to a whole range of conditions that share that same characteristic pain and modalities.
This includes everything from facial neuralgia to hepatitis, and even as a palliative for those very specific tearing pains that you can see in stomach cancer.
All right, let's move on to the modalities, which are, in my opinion, absolutely critical for differentiating any remedy. They really provide the final confirmation.
I mean, just look at this picture of aggravation. It's so overwhelming. The patient is made worse by nearly any stimulus you can think of: motion, touch, exertion, changes in weather, and especially cold. Any meaningful relief is found almost exclusively in complete and total rest. This extreme, wide-ranging sensitivity is just such a powerful diagnostic marker.
So, to prescribe this with real accuracy, we have to differentiate Actaea Spicata from its closest relatives. Let's put it side by side with some of the other remedies you might be considering in a similar case.
This table gives you a really clear at-a-glance comparison. Look at Simicifiga. It targets muscles and the spine, and you think of it more for women. Caliophyllum also hits the small joints, but it's more the fingers, and the pains are erratic and shifting. And then there's Ledum, a great gout remedy, but it's famously better from cold applications, the absolute polar opposite of Actaea Spicata. This really highlights that unique focus on the wrist and often the male constitution for our remedy.
So these are the prescribing pearls you need right at your fingertips. When you see a case of right wrist rheumatism in a chilly, older man, and it's aggravated by the slightest motion, and it was brought on by just a little bit of exertion, Actaea Spicata has to be right at the top of your list.
So I'll conclude with this question for you to think about. Given its very precise and unique picture, where might this often overlooked remedy be the exact similimum that one of your patients is waiting for? It may not be a huge polycrest, but within its narrow, specific sphere of action, its results can be profoundly curative.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.